I'm going to talk to you about a controversial topic, euthanasia. Is euthanasia an alternative to patients who desire to die? To die or not to die is the question. Do you think people with terminal illnesses or disabilities should have the choice of euthanasia? In the United States, euthanasia is illegal in all the states except for the state of Oregon. Legalizing euthanasia will help alleviate suffering of terminally ill patients. It would be inhuman and unfair to make them endure the unbearable pain. Throughout my speech, you'll be able to see some of the pros why euthanasia should be legalized. The Collins English Dictionary definition describes euthanasia as the act of putting to death painlessly or allowing the terminal ill to die, as by withholding extreme medical measures. A person suffering from an incurable, especially a painful disease or condition. Euthanasia is sometimes referred to as mercy killing. Euthanasia is categorized in different ways, which include voluntary, non-voluntary, or involuntary. Voluntary euthanasia is legal in some countries in the United States. Non-voluntary euthanasia is illegal in all countries. However, in the Netherlands, physicians can avoid prosecution by following well-described and strict conditions when non-voluntary euthanasia is performed on infants. Involuntary euthanasia is usually considered murder. Unbearable pain is probably the major argument in favor of euthanasia. Euthanasia advocates stress the cases of unbearable pain as reason for euthanasia, but then they soon include a drug state. Nearly all pain can be eliminated, and in those rare cases where it can't be eliminated, it can still be reduced significantly if proper treatment is provided. Everyone, whether it be a person with a life-threatening illness or a chronic condition, has the right to pain relief. With modern advances in pain control, no patient should be ever in excruciating pain. Demanding a right to end your life is probably the second most common pro-euthanasia point people bring up. It's what many people feel is their right. But what should be understood is not giving a right to the person who is killed, but to the person who does the killing. In other words, euthanasia is not about the right to die. It's about the right to assist in death. Euthanasia is not about giving rights to the person who dies, but instead it's about changing the law and public policy so that doctors, relatives, and others can directly and intentionally end another person's life. The third point is, should terminally ill people have the right to end their life, specifically if suffering from excruciating pain? Neither the law nor medical ethics requires that everything be done to keep a person alive. There comes a time when continuing attempts to cure are not compassionate, wise, or medically sound. That is the time when all efforts should be placed on making the patient's remaining time comfortable. In cases of individuals suffering from incurable diseases or in conditions where effective treatment wouldn't affect their quality of life, they should be given the liberty to choose induced death. Also, the motive of euthanasia is to aid in dying painlessly, and thus should be considered and accepted by law. Although killing in an attempt to defend oneself is far different for mercy killing, law does find it worth approving. In an attempt to provide medical and emotional care to the patient, a doctor should prescribe medicines that will relieve their suffering, even if the medications cause gross side effects. This means that dealing with agony and distress should be the priority, even if it affects the life expectancy. Euthanasia should be a natural extension of patients' rights, allowing them to decide the value of life and death. Maintaining life support systems against patients' wish is considered unethical by law as well as medical philosophy. If the patient has the right to discontinue treatment, why would he not have the right to shorten his lifetime to escape the intolerable anguish? Isn't the pain of waiting for death frightening and traumatic enough? It is often said that euthanasia is an act of last resort, something that comes in when all other treatment alternatives have been exhausted and there is nothing else to do. A patient may still qualify for euthanasia because a substantial requirement is that the treatment alternative be acceptable to the patient. Ongoing, unreleased suffering gives rise to the loss of hope and despair. The patient whose symptoms have not or cannot be adequately controlled may ask for euthanasia to escape their suffering and or restore their dignity. Not everyone accepts that society would be damaged by accepting euthanasia as an alternative way to end life. Hopelessly ill people who in the end will have to die in unbearable pain wish to be freed from a life that has become a burden to them. They should not be compelled against their will to endure their meaningless suffering. In conclusion, under extenuating circumstances, euthanasia should be made legal in the United States. If legalized, it will prevent pain and suffering of terminally ill patients. Doctors would then be able to play a key role in reducing possible abuses of the process. Terminally ill patients found to be incompetent would not be allowed to make end-of-life decisions. The patients may not have the ability to make well-informed, rational decisions unless they have made an advance directive request in writing, clearly stating their wishes. Thank you very much.